Hi, everyone. I'm Steve Adubato. We kick off this program with Dr. Elizabeth Clemente, who is the chair of the Department of Dentistry at Morristown Medical Center. Doctor, so good to have you with us.
Thank you very much. It's a pleasure to be here.
You got it. Let's talk about dental health, which is a lot more than simply dealing with cavities and cleaning your teeth. Oral health, please.
So the mouth is the doorway to the body, and whatever goes in or is infected, et cetera, goes out. So it's very important that the mouth, and it's critical in digestion and a number of other bodily functions. So it's important that your mouth is clean and functional and free of decay and infection.
So let's do this. One of the biggest reasons we have you on is because you're very focused in the work you're doing with the Morristown Medical Center Dental Clinic in dealing with the fact that a disproportionate number, just way too many people who are struggling financially, particularly in communities of color, are not getting the dental/oral health that they need. This is an issue of health equity, is it not?
Yes, it is, absolutely.
Talk about that.
So what most people don't realize is that this clinic has been in existence since 1960. A group of volunteer dentists would come in and take care of emergent patients who had dental problems. Since then, our first resident was graduated in 1972. So this residency program has been here 50 years. So it's not like a new thing for this community. What happens is my staff of approximately 120 docs pay dues to the hospital. And remember, most dentists do not make a living in a hospital. They make it in their office. So they pay dues to belong on staff to come here on a volunteer basis to help me teach these residents. And
why do they do it?
Because there's a need, and dentists run their own ORs and everything else. So someone needs to take care of the underserved, and this is a very convenient way to do it in terms of we can take care of their dental health. We often evaluate, we always evaluate the physical health. So we turn them over to the physicians in the hospital if we catch something, i.e. high blood pressure, uncontrolled diabetes, those sorts of things. So it's a great place to handle this population, because we have the ability to solve their other problems also.
Doctor, talk about, the numbers are striking to me, the number of patients you deal with every year, the number of procedures performed every year, please.
Well, we work 5 days a week. I start off with brand new residents every July 1st. We have a lot of backup, as I said. Sometimes we have 4 docs in here for the 4 residents who are here. So coming into the 4 volunteer docs here to come in and help out. They start off very slowly, but in the end, we do every procedure that any other general dentist does. And they're up to speed. Actually, about now, they're getting up to speed they could go out and practice, but they choose to come here because of the expanded training that we offer them.
Let's do this. You talked about some of the I shouldn't say larger, but some of the significant health issues, challenges, and problems that are identified through an oral checkup. Could you go through some of them? Because I'm often struck by, I thought I knew, and then I realized that there were some health issues, medical issues that are potentially identified that I didn't even realize, please.
So for example, bleeding gums is an indication of an infection generally, but it could be a blood disorder or dyscrasia. Rampant decay, there is issues with diet possibly, but also with metabolism. They could be diabetic, and that's an issue for diabetics. They decay very quickly. The sugar is in their saliva, and it's rinsing their teeth on a regular basis. So those are 2 of the big ones. But you must remember that we also take blood pressure, and we catch blood pressure problems on a regular basis.
Cardiac issues? Yes,
and we do all of a pre-screen that we can do physically as a dentist, so that patients, we know what's going on with them medically. Very often this patient population is not receiving, consistent medical care. So people will come in and say, I stopped, they're weaving down the aisle, and I say, did you take your insulin? Well, I haven't been taking it because I ran out of it and I haven't been able to refill it, that sort of thing. So those are the kinds of things that we catch medically and refer back down to the ED on a regular basis.
Doctor, what
Patients
happens if,
on us.
I'm sorry for interrupting, what happens if those potential problems, medical problems, are not identified through an oral dental checkup? I know it's case by case, but those situations often only get worse.
That's right. And then we end up with the patient who walks in and goes down on us, which does happen. And then, then we're in a really emergent situation because it wasn't picked up ahead of time. We also try to encourage these patients to stay on their medication, and we try to help them find ways to get their medication so that they can keep going keep everything running the way it's supposed to be.
Let me also say this, that Morristown Medical Center, part of Atlantic Health, one of the healthcare organizations that support our healthcare programming at the Caucus Educational Corporation. Let me ask you this, Doctor. The world of dentistry changed dramatically over many years. The biggest impact of COVID on dentistry has been?
Well, initially, from a private practice standpoint, people had to limit the number of people they could see, patients they could see during a day, because you couldn't, you had to wipe, it involved running strictly like an OR, where you had to reset and reboot, and you couldn't have a certain number of people in a waiting room or in a small space. So it cut down on the number of patients private practice practitioners were allowed to see. Fortunately for us, we were fitted with a negative pressure room to help cut down on spread of any potential infection. We also were fitted, we've always worn masks, as you know, as a dentist always wears a mask, glasses, and a gown. So we were able to continue our sort of hyped OR procedure and protocol. And because of the hospital, they had the equipment, they had everything we needed, and they provided it to us so we continue to see patients and take care of them.
Great. Dr. Elizabeth Clemente, I want to thank you so much for joining us. Important information.
Thank you.
All the best. Stay with us. We'll be right back.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by Delta Dental of New Jersey, the Russell Berry Foundation, the Adler Aphasia Center, Robert Wood Johnson Foundation, Community Food Bank of New Jersey, Summit Health, the North Ward Center, New Jersey's Clean Energy Program, and by Johnson & Johnson. Promotional support provided by the New Jersey Business and Industry Association and by New Jersey Monthly.
Did you know that you can save money while saving the environment? New Jersey's Clean Energy Program offers incentives, programs, and services that benefit New Jersey residents and businesses, as well as educational, government, and nonprofit entities, helping us save money, energy, and the environment. Learn more at njcleanenergy.com or call 866-NJ-SMART. New Jersey's Clean Energy Program, lighting the way to a clean energy future.